Shirodhara. How does it act? Hello everyone, what is up with you? This is Doctor.Sreeraj here, and in this video we will discuss about how various Ayurvedic treatment procedures work on the human body. It's a question from many of my patients ever since I started my career, that how does each of our procedures work on the human body to relieve the ailments and symptoms? Well, it is a vast topic, but let me sum it up with a specific example of how does Shirodhara work on us. For those who don't know what Shirodhara is, it is a very popular and powerful Ayurvedic treatment procedure done by streaming certain medicated fluids on your forehead from a specific height for a specific duration, moving like a pendulum swings. We use hundreds of types of oils, processed milk or buttermilk, fresh juice of certain herbs, etc. as the medium to do Shirodhara. It is certainly one among the most popular applications of oil externally. It is a frequently asked question that whether is it the medicine or the procedure doing the job of curing ailments. Well, I must say both in the case of Shirodhara. Shirodhara is a procedure that works as a medication and as a meditative process at the same time. Let us have a close observation by looking at the probable influencing factors of doing Shirodhara. Well, this is not rocket science, but just trying to explain things with a logical reasoning. Let us take a few factors connected with Shirodhara. The first one is the anatomical importance of the place it's been done. Yes, the forehead. It is definitely a significant place than others due to several reasons. Head is a super sensitive area where the brain, all the sense organs and the cranial nerves are situated in one single place. Your head is more sensitive to heat and cold than many other parts of the body. Ayurveda says there are several marmas or vital points on your forehead. The motor and sensory nerves of the forehead, which are situated underneath the skin, are directly connected with the cranial nerves. You can even sense the presence of anything that is hovering or pointing towards the forehead even if your eyes are closed. It is that pressure sensitive. Number 2. Influencing the electrical activities of the brain. The brain cells communicate each other through certain electrical impulses. An electroencephalogram or EEG is used to track, record and evaluate the electrical discharges of the brain. When you have an abnormal electrical discharge, you may get epileptic seizures. By doing Shirodhara, I've practically seen that the number of episodes and its aftermath of such seizures are considerably reducing in many patients. Of course, much research is needed to see how Shirodhara is influencing those abnormal electrical discharges in a positive way. But it's obvious that it's a big impact on them. Number 3. The spiritual and philosophical importance of the forehead. In yoga and other Indian spiritual traditions, the forehead is a location of Ajna Chakra or the third eye, which is referred to as the gate that leads to open to higher consciousness. Some theosophists even suggested that the third eye is in fact the partially dormant pineal gland which resides between the two hemispheres of the brain. The effect of Shirodhara on your endocrine hormonal system could be due to its effect on the pineal gland and the pituitary glands. We can clearly see an effect of doing Shirodhara on insulin-resistant diabetes, thyroid dysfunction and other hormonal imbalances. Number 4. The effect on the mind-body connection. Although your mind is not just confined to brain, it physically involves brain, the sense organs and the nervous system as a major integral part in sensing the feelings. Shirodhara stabilizes the mood swings and helps to fight other psychological disorders. Through the mind as a medium, the brain can communicate better with any part of the body that needs a repairing process. It doesn't mean that the brain needs Shirodhara always to communicate with the organs, but it helps to focus intensely on specific places. No wonder that the same procedure is capable of acting on multiple systems and organs. Sirodhara also rectifies a compromised immune system and thereby has a huge influence on almost all autoimmune disorders. The same is good for insomnia, migraines, and other related disorders. Number 5. The placebo effect. I don't think it's a negative thing to mention. In fact, placebo, as it literally means, helps the patient to involve psychologically in curing an ailment. Of course, the medicines and procedures can act better when the patient who undergoes has a positive, optimistic attitude towards it. That is one of the basic qualities a patient should have. Number 6. By improving the blood circulation. Due to the tiny pressure that it exerts on the site done, it improves vascularity to that place. Not only just on the head, but also if similar warm fluid is streamed on a deteriorating joint or any other affected area, can actually bring more bloody attention to that place and thereby helps healing. It works wonderfully on stroke cases, traumatic brain injuries, and other neurological defects by this method to dissolve the old blood clots. Hope you have an idea about how Sirodhara works by watching this. But before concluding, I would like to talk to you about a procedure that has certain similarities with Sirodhara, which is mentioned in the history a few centuries back. You might have heard of Chinese water torture, which is a painful process in which the water is slowly dripped onto the scalp, allegedly making the restrained victim totally insane. This form of torture was first described under a different term in Italy in the 15th century. It was even claimed to have experimented in Hitler's concentration camps. The procedure is, however, done to make a negative impact, unlike Sirodhara. It's exactly done the extreme opposite way how Sirodhara is performed. So is the bad effect. The major difference is the height from which the fluids fall from, the intermittent drop by drop flow, the type of fluids used, etc. Well, there are many other points I can justify the effect of doing Sirodhara, but due to time constraints, I'm going to wind up here. This is not a conclusive one. It is still debatable and can reach to more convincing perspectives later on. I'll see you with another video soon with another topic to discuss with. Until then, stay safe and take care. Bye-bye.